You're listening to The Drive Home.
Alrighty, gang, it's 4:30 on The Drive Home for Thursday. Wayne, Tanya, and Brian all here and accounted for.
You bet.
Along with our special guest, we are so proud to have on once again Dr. Ryan Jennings, the Chief Medical Officer of HSHS St. Anthony's Memorial Hospital. Good afternoon, Doc. How are you?
Hey, I'm well. How are you guys doing?
Good.
We're all right.
Knock on wood, everybody here, Doc, so far has been healthy. Few of us have gotten tested.
Yeah.
Yeah, but we've all come out good, and so things have been all right here.
That's the way we're trying to keep it. And, I can talk about COVID, but I cannot believe Wayne didn't recognize that movie.
I know, right?
He recognizes 3 words from movies that only 2 people ever saw. And he doesn't recognize it.
Wow.
One of the biggest movies of all time.
So I've honestly
wrecked my truck.
How many times have you watched the movie?
Oh, hundreds.
See?
I mean, literally hundreds.
Wow.
He's the
I
only.
could probably reenact that entire scene. That was right when Dorothy woke back up, and they were all there, and you finally can make the connection that they were all, part of her family.
That's right.
Doc, I guess if you're going to get thrown under the bus, it's good to be thrown under the bus by a doctor because he can treat you afterwards, right?
Yeah. In shock.
Oh, there you go.
I get first aid for the Greyhound.
You never had to look any further than your backyard before, but
this
now
is
you
true.
Move, so
that's right. That's right. Doc, we're so glad to have you on. Of course, and wish it was under better circumstances, but we might as well get the elephant out of the room. 44 new cases announced last night by Effingham County's Health Department, including sort of a tag in their release last night that talked about that this is overwhelming them as far as a system and a department goes.
Yeah, and I think you're hitting where we're at and why there's so much concern right now. I mean, there's kind of 2 things happening concurrently. One, of course, is that as we've expanded our ability to test and those types of things, and the health department had some additional testing, we've seen more positivity. And a lot of those folks, gratefully have been doing pretty well. And so the vast majority, as they've noted, are still being able to be sent home on isolation and, doing just fine. But, my concern, and I think I've talked about this more than once, is that, the whole premise of this is trying to make sure that we don't end up with more and more hospitalized cases. And, we are starting to see additional folks presenting to the hospital that are significantly ill. They are requiring hospitalization. Fortunately, as you look at the numbers on the whole, our bed status remains good because if you recall, part of the criteria for when the governor talks about putting in additional mitigation strategies relates not only to the % positive, but also to the healthcare resources that are still available. And, right now we've been fortunate. We continue to have adequate, availability of protective equipment. We've got adequate availability of bed space and ventilators and all those things. Although ventilators have fortunately not been the solution. So that's good news as we've learned more about the disease. But so we're in a good position there, and we're ready to take care of any problem, and it's certainly safe to come and take care of it. And we don't want anybody delaying care because of concerns about COVID. But we definitely look much different than we did even when you and I all started this conversation however many months ago. It seems like forever, and reality is when you really sit back and think about it, there wasn't a case in the United States until the end of February. So this is really still pretty new stuff, that we're managing our way through. So it certainly, we have more folks that are presenting now with positive testing, more folks presenting now that are sick enough to be in the hospital than we were, earlier in the course of this when it was getting a lot more attention. And, there's a lot of speculation that's actually an artifact of the fact that people are kind of wore out with it. And so coming back on and kind of reinforcing the behaviors that have kept us, early on, we were very lucky, but we were very, very attentive to masking and hand washing and social distancing, and things were shut down. As we've seen things open up, and maybe we're not as meticulous as we were early on. We're starting to see that. And of course, some of that's school, some of that, there's a lot of things that are going on all at once that are kind of changing the numbers.
Doc, you kind of hit the nail on the head there when you talked about the fact that basically when we started out with this, we were really lucky. I guess the question I would have for you, and I'm not going to make this political, okay? I'm not, because I hate that that's even been brought into this at all, that science and medicine that we need to get through with this. But there's a lot of folks concerned that Illinois could potentially shut our area down again. It's been talked about a lot. If we get on the warning part of this, what's going to happen with that? For the folks that are concerned about that have businesses that are trying their best to get through this, what would you say to the public and to those business owners is the best way for us to navigate through this and stay open at the same time?
Well, that it's such a timely question because honestly, that has been one of my biggest concerns about this. And I had the opportunity to speak with the Chamber of Commerce members and things like that last week about exactly that, because the health impact is real, and again, we're seeing more health impact and sicker folks than what we did even at the beginning. But just as serious is the idea that if this trajectory continues and we move forward with the mitigation plans put forward by the state, then we'll end up having to go backwards on the Restore Illinois plan and potentially have to navigate our way through another episode of restaurants closing, non-essential, so-called non-essential businesses closing, and there are many that cannot survive that. And so, when I met with the business leaders, the emphasis was around those big things we just touched on: hand washing, distancing, and masking, and being role models of that. By the way, you have a lot at stake as a business leader in the community if your business gets closed. Whether you agree with the politics or not really doesn't make any difference. The reality is that somebody's going to make a decision that could negatively impact your business based upon data. And right now, the data would indicate that the number of cases, especially per capita, is on a trajectory that's going to put us in a position where they're going to very seriously consider mitigation strategies. Now, statewide, they just put in some additional mitigation strategies specifically for restaurants and bars related to, asking patrons to wear face masks until, they're seated and eating, and if you're up and walking around, and if you're going through a drive-through window, and those types of things to kind of beef up the masking. But we have already seen Region 4 and Region 7 go beyond that with restrictions in hours, a decrease in the percentage of occupancy that's allowed. And the only, I won't say saving grace, I guess, but one of the nice things in the new mitigation plan strategy is they are looking at this kind of in two weeks at a time. So they're putting in a ruling and saying, all right, you broke the threshold. You either had more than 8% positive rate, which we actually still look pretty good at, but there's also a window around an increase in the number of cases and a limitation in the number of beds available. We've seen an increase in the percentage in the numbers of cases as a percentage. We've been not having, we're having increased bed occupancy, but right now we still have a pretty good window because you have to be below a 20% bed capacity rate before it triggers the next step. And so far, we've been able to maintain bed occupancy rates that are lower than that. But I'm concerned because I'm definitely seeing more folks in hospital beds than ever across not just us, but our entire health system. Still capacity, it's not a problem as far as the ability to serve those that need us. Yeah. But concerning just because of the trajectory we're on. The other thing for business leaders is to think about, and businesses in general, how to think about how do you operate safely in this environment, and do you get creative? My goodness, the creativity that we've seen in this community with all the, outdoor access, the ordering online, the calling ahead for an appointment. If you're going to go get furniture, you can, schedule a time so that they limit how many people are in the store, at any given moment, making sure that you distance. Some of the solutions that people have come up with are just brilliant. And then, of course, asking folks, to be hand sanitizing, distancing, wearing masks when they're on the premises, those types of things clearly help.
Now, I had someone email me the last time that you were on, so I've kept this email for several weeks. And I know because this gentleman enjoys the talks that we have with you, which I've heard a lot of people do enjoy our little discussions, and it has to do with the face masks. I think he was concerned that the governor had suggested wearing the face mask until vaccines were widely available. What if a vaccine is not available in the near future, or they're still testing for years on down the road? Does that mean face masks are somewhat a new accessory on our face forever?
No, really great question. And that is the guidance in the Restore Illinois plan. There's two parts to that. One is the reality around vaccination. The first part of that is that, they have done a tremendous amount of work in an incredibly short period of time around development of vaccines. And we already have vaccines that are in, the kind of level 3 reviews, as far as being able to get them out onto the market. That would normally have taken years, if not, a decade to even move into that. So one, the pathway to having a widespread vaccine has been, thankfully, a lot of political roadblocks, and some of those things have been removed. Now, that comes at a price, because obviously one of the benefits of doing long-term studies on vaccines before they're rolled out to the public is the ability to study a small group of people to make sure that there's not some unexpected consequence of the vaccine. And, obviously I'm pro-vaccine. I think that I think there's a couple things around vaccines that are really important this year. And one is, let's hope that we get maybe some movement towards an actual COVID vaccine sooner than later. But two is, the worst thing that can happen to somebody right now is that you show up with COVID plus influenza, or you get COVID plus pneumonia, you get COVID plus pertussis. We have a few vaccines that maybe we don't always pay as much attention to, that if you end up with a double whammy, could really hurt you. So this is a really good year to make sure you get your flu vaccine, because you don't want flu plus COVID. If you've not gotten your pneumonia vaccine, and there's a couple different ones depending upon your age group, it's a really good year to go get your pneumonia vaccines, and those aren't seasonal. Those you can go get at any time. Similarly, there's a lot of folks that have not gotten an update on their tetanus, which now then when you get your tetanus updated, if you're in a certain population, we update your pertussis vaccine, which is whooping cough. So that is also a great way to potentially protect yourself. So does the mask become a permanent accessory? Some of that will depend upon what happens in the coming weeks, especially as we've introduced students back into school, and we do start seeing a certain percentage of folks that turn positive that then are not necessarily symptomatic or sick, that may get us to that concept of herd immunity without vaccination. So there's two ways to get to herd immunity. One way is that everybody gets it, and then the herd has got it, and it's done. The second way to get there is through vaccination. Of course, I guess the third way is some combination thereof. So, as we introduce, the school children and things like that, and we're seeing this uptick in the number of cases, the only good thing coming out of that potentially is increasing herd immunity. And as of right now, as far as we know, there's been one documented case of what folks are describing as a reinfection.
I heard about this yesterday,
Oh, yeah.
Yeah, for the most part, there's been no documented reinfection with this virus, especially as long as it doesn't decide to mutate again, and then here we go again.
Yeah.
But presumably, if you've had this virus, you're now immune to it. And so the other way to get to the governor's, and the governor wrote this thing, like you said, this was how many weeks ago when we talked about it, when not just the governor, but the IDPH, et cetera, participated in writing this plan. The concept of herd immunity is really what he was trying to get at, without specifically knowing much about what was going to happen in the public spread of it as a source as opposed to vaccine. So I would anticipate that the concept of moving to phase 5 will modify as we see what's called seropositivity, meaning when you draw people's blood, they've got antibodies that show they've had the infection. And if this virus acts like most other viruses, you would not be likely to be able to be reinfected. Unfortunately, we still don't know that to be fact. We presume it is. And again, we've had only one documented case, to my knowledge, worldwide of what they're considering a reinfection. So I think on the whole, that's a likely path that this virus will follow. But a fantastic question. Either way, if you're banking on your mask that you're currently wearing, making it to the end of this, I'd buy another dozen.
Yeah.
I did today, actually. Bought some more. Yeah,
some more. I think they're going to be around a while.
I will have to say I've seen so many different creative-looking masks out there.
Oh, absolutely. And, you know, the cloth face mask idea really, again, is the idea of protecting you from coughing, sneezing, spitting on somebody else. You know, so you just want to make sure it conforms to your face well, is comfortable to wear, and you know, for folks that have any kind of difficulty breathing, that they're able to breathe through it, that you keep it clean, that you sanitize your hands when you take it on and off, so that you're not then getting whatever on your hands and touching somewhere else. You know, are really the key measures, and so kind of it's an interesting accessory. I look so much better with mine on. I get compliments. Like, Jennings, I walk in the room and could you just put your mask back on, please?
Hey, Dr. Jennings, I know we're about out of time, but I did want to give you a chance. If, you know, with the rise in cases, I think it's getting a little closer to home for many people, so they're hearing more terminology of things, and a big terminology question is this issue of isolation versus quarantine, and that's more of a, you know, an active measure on what you do after something happens. Do you want to take a second out and just to explain that to the listeners?
Sure. Real fast, and this is a really complicated concept, but there's really two things. Mm-hmm. Isolation means that I'm infected or suspected to be infected, and so the health department or whoever has instructed me to stay away from other people. I'm being put in isolation. We do the same thing in the hospital for other things. If you come in with influenza, the flu, we put you in isolation, meaning we make you be in a room by yourself with nobody else coming in and out as much as possible. And when they do, they wear protective gear. So that's isolation. Quarantine means you're actually well, but you've been exposed to someone who might be carrying the disease, and you may be carrying it and not be aware of it. So there's a distinction there, and that where it really gets difficult is because the guidance around isolation says basically for most people, if you are 10 days out from when you were diagnosed or became ill and you're feeling better and your fever is gone for more than 24 hours, you can leave isolation. Quarantine starts at the time that you last were in contact with an infected person and then lasts for 14 days beyond your last contact where you may have become infected. So if you're a parent of a child and you had to stay home and watch your child for the 10 days that they were in isolation, your quarantine doesn't start till their 10th day. Mm-hmm. So you may have a 24-day stretch, which is where the workforce is really having a hard time with this. Employers are having a very difficult time with covering their workforce needs. Yep.
Parents are screaming, "Oh God, no!"
Yeah. and then of course, if you get sick during your quarantine, then your 10 days start. Yeah. So, you know, so you could be 10 days in, start a quarantine for 14 days. You're 7 days into that, which means you're 17 days out, go into quarantine or go into isolation because you got sick, and you got 27 days before you're able to, to return to the workforce. So
that's a long time without even seeing a judge, Doc. I mean,
wow,
that's a lot of Hallmark movies.
I understand, and the health department's done an amazing job and trying to orchestrate, all this, especially as the case arises. You made the comment that they're feeling overwhelmed. We've had some of the same issues although we've been blessed with having some additional testing supplies, there's some reality on how fast the machine can churn out results. So we're having some limitations just in the ability to just the machine can only do so much. You know, if I got a 42-inch lawnmower, it's only going to mow so fast.
Good analogy. Perfect.
All right.
All right, Doc, as we look to update our cutting decks on our lawnmowers, it was so good to talk to you as always.
Yeah.
Yes.
You're a wealth of information.
You guys give me the time, and especially a little extra time, and you guys stay safe, please.
You too.
Absolutely. Appreciate it, Doc. That is Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony Memorial Hospital. We are blessed to have him here in town and blessed to have him on the radio with us every once in a while to talk about all that's going on.